It's another Friday afternoon, and staff at the Texas Medical Center are gearing up for a hectic night ahead.
X-ray!
We had a guy who had a part of a house fall on his leg, and we did an amputation on his leg just about an hour ago. And we've had 3 seriously injured patients come in the last 20 minutes or so.
Flight Flight 6, head landing south.
Control Flight Flight 6, landing at fuel.
This is the largest medical complex in the world. A virtual satellite city near downtown Houston. But 1 in 3 Texans don't have any kind of health insurance. The only way they can make it in here is if they're sick enough to be sent to emergency.
I enjoy trauma because when the patients come in, I don't require the insurance status. It's irrelevant. And so it's one of the segments of the healthcare system where we have open access to everybody.
46 million Americans can't afford insurance. And as the economy gets worse, that number's expected to rise. And even if you are insured, it still might not get you into the hospitals at the Texas Medical Center. That's what happened to the Kelly family.
Everything's gonna be okay. Everything's gonna be good. You're looking good.
You have no idea when you go to the hospital what you're looking at, what their charges are. And plus, our insurance is so expensive, we couldn't afford it.
3 years ago, Lisa Kelly and her husband Sam were looking forward to a comfortable retirement.
See how pretty the pond is?
Like many Americans, they had basic health insurance.
Pretty pond out here.
Then the bottom fell out of their world. Lisa was diagnosed with leukemia.
The very first day is the most emotional.
I'm glad you're here.
You're just kind of in a daze. It's just, you're in shock. You have no idea.
After Lisa Kelly's diagnosis, doctors told her that this was the place she needed to come to for treatment, the MD Anderson Cancer Center in Houston, about an hour and a half's drive from her home. But even before the first appointment, it became clear that the family was facing not just a medical crisis, but a financial one.
I called, made an appointment, gave them my insurance information. They called me back, I'm sorry, you're going to have the money for us to make you an appointment.
How much money?
I had to, the very first day, I had to go up there with a check for $45,000 before they would give me an appointment.
They managed to pay it, but it didn't stop there.
I mean, even the doctor came out and said, this could cost you anywhere from $250,000 to $500,000 to get your wife well. I said, okay. I would give up everything I got to keep her.
On one occasion, as Lisa Kelly waited with a drip in her arm in the middle of chemotherapy treatment, staff said the appointment would only continue if her husband went and made yet another payment.
My machine was beeping because it was empty and I needed another bag. And she said, one of you are going to have to go down to the business office before we can take you to the back and rehook you. It was one of those rough days.
Yeah, one of them rough days.
What kept you going on the days when it was really difficult?
Just to keep her going.
Just to help her get through it and get better?
Good morning. My name is Holly Wallach. I'm from Administrative Solutions Plus, and I'd like to speak to you about the account of Lisa Kelly, account 69.
As they faced the prospect of having to sell their home to pay medical bills, Lisa Kelly heard about someone she hoped could help, billing advocate Holly Wallach.
Her total self-pay charges come to 143,000.
Holly Wallach lives and works in Florida, spending her days contacting the billing departments of hospitals across the nation, trying to get a fair deal for her clients.
Then who is authorized, and I would love to have their name and number.
Now, Lisa was underinsured. Was she being irresponsible?
No, I don't believe that that was that she was not responsible. I think that she was underinsured, and I think that there are a number of companies that are selling this type of insurance, and 25 million Americans have it. I think it's not sold properly. I think that people believe that they're buying adequate coverage, and none of these 25 million people realize that they're underinsured, and the only way they'll realize it is, God forbid, if they get ill.
Management of the MD Anderson Cancer Centre refused our request for an interview. But the hospital's policy of upfront payment is not unusual, as US hospitals face growing bad debt from the massive number of uninsured patients. The cost, complexity and failures of its health system have grown over time to become America's most profound domestic policy problem. Hillary Clinton, for one, tried to change the system back in the 1990s.
Nothing is more important to our nation than ensuring that every American has comprehensive health care benefits that can never be taken away.
Her plan was killed off by the powerful interest groups, including insurance and drug companies.
The opponents of healthcare will always use words like government takeover, rationing, socialization, communism, you know, you name it. They use terms of art that have no relevance to the current debate. They try to scare people. They know that in the past, fear has beaten hope.
Chris Jennings was the healthcare guy in the Clinton White House and is now advising the new administration.
Oh, I can tell you, when President Clinton and Hillary Clinton would travel around the world, the one question they could never answer, all the foreign dignitaries, was how can you be a great and, you know, in the economic power that you are and you say you are, and leave so many people behind?
He's heard all the arguments against change, but says this time it's different.
Everyone sees that the current system is absolutely unsustainable, and they see that actually failure to act could create more problems than acting. The President's commitment is to develop a system that does cover every single American. It will include specific financial support for people to be able to afford health care through tax credits and direct financial assistance, both through the private sector and the public sector.
Unlike Hillary Clinton, President Obama is managing to keep the insurance companies on side with the promise of increased market share.
We have a crisis, and that's the only time this country does big things. We have an economic crisis. It's linked to health care. And when we have these type of environments, people look towards the federal government to do and take more of a leadership role.
I watched the election coverage and I was so into it. He knows what it is to not have that insurance and to need the help, and no one will help you.
What do you think about the fact? Shalonda Frederick believes President Obama will provide that leadership, and she needs it.
It's totally unbelievable. It's like, you know, they tell you, you know, no child left behind. You go to school, you go to college, you get to have a career, you be productive. Well, I did all that, but no child. I didn't get left behind as a child, but I'm getting totally screwed as an adult. It's just unbelievable.
Shalonda Frederick lives less than an hour from the decision makers in Congress. She did all the right things, worked hard, paid her taxes, had health insurance. But now she can't afford the medication to slow the cruel progression of multiple sclerosis. What difference does it make when you actually get the medication?
It just makes you feel better. You feel like the MS isn't winning. Princess, good girl. It's a total different way of life. I can, you know, play with my dog. I can focus on doing what I'm doing. It makes your mind clear because you don't have to worry about, am I going to fall?
Like most Americans, the 33-year-old's health cover was provided by her employer. So when she lost her job because of her illness, she also lost her insurance.
So you simply do not have the money to buy your medicine?
Yeah.
How much would it be?
Whatever the shots you may need or the treatments you can do, that could be $3,000 to $5,000 per month or every 3 months, depending on how often you do them. And I mean, there's just no way. It's just not possible.
When did you have your last lot of medication?
The last week of July. Last year, the last week of July. What kind of ponytail do you want today?
There is government assistance for the poor called Medicaid, but in Maryland, where Shalonda lives, you can't earn more than $360 a month to qualify, and her disability pension puts her over the limit. So she has to wait until April next year before she qualifies for government funding for her medication.
April's not even in my vocabulary right now. My point is, do you even know if any of those medicines are gonna work? My fear is that I'm gonna be too far gone. You know, I'm not a give up, whiny type person, and for this to happen, I am terrified. It's like, at the end of the day, I am 33. I'm 33 years old, and there's just no, I'm sorry, there's nothing there. It's like, I didn't do anything. And apparently it doesn't matter. You see people every day that do bad stuff and they get over. And I'm the dummy that chose to live right. And there's like there's nothing there. It's like I'm being penalized because I chose to do the right thing.
As unemployment grows, there are sure to be many more Shalonda Fredericks. In some parts of America, whole communities are suffering.
All right, good morning, folks. Sorry about the weather.
It's the middle of the night in the middle of winter, but people are lining up and waiting for their number to be called.
Show us your numbers, please.
This weekend, the sports stadium outside Hazard, Kentucky, has been turned into a free medical clinic by a charity originally set up to help people in the remote Amazon jungle, until they realised people in the world's richest country need their help just as much.
17. Come on down.
We got here about 6:30 yesterday evening, and I'm here for my heart and a cancer screening, and then my husband, he's here for glasses, and he really needs them.
I'm 39 years old, I make this, sir. If I get them today, I'll be fine. If I don't, I'll be fine. What can you do?
Ava Sloan has no teeth and hopes to be fitted for dentures today.
Right. Now, I couldn't afford dentures. They're like $300 or $400, and I don't have that kind of money. I don't have no money.
Surgical pretty quick if you need to, okay? Yeah, let me know if
Craig Evans lost his job 2 years ago when the company he worked for relocated to Mexico. Today he's finally getting an infected tooth extracted.
Since we lost our job, we just couldn't afford the medical insurance. If a clinic like this wasn't here, we wouldn't even got these things today.
Now I think these are a little bigger. These are smaller.
Craig Evans' mother Linda is choosing a new pair of glasses. After losing her job and her health insurance, this is the first time in her life she's had to rely on a free service.
Congress and all of them should take notice of what us Americans have to do anymore, which we have to lower our pride and all this. And it's good, but it's also bad for us, you know, because we're independent people.
Harrison's still on his feet. Harrison is going to go all the way and waiting for the official to get there. Touchdown is signaled.
Back in Texas, Lisa Kelly and her family are gathering to watch the Super Bowl. And they're expecting a special guest.
I can't be so happy to meet you.
Holly Wallach has arrived from Florida.
Finally.
Yes, it is. I'm gonna cry.
It's the first time the women have met after 2 years of phone calls and emails.
Beautiful home. Other services. I love that. Other services, $1,050.
She's come to Texas to visit the MD Anderson Cancer Center and to challenge more of the Kellys' bills.
He was mad
I was pretty pissed off.
With the advocate's help, Lisa Kelly's been able to afford a stem cell transplant to fight her cancer.
This is your $9,000 shot. Remember this shot?
Yeah.
Okay. The bills are egregious, some of them. Some of the charges, for instance, for sodium chloride, you take a bag that cost $1.25 and they're charging $65 for it. Every company, every business is entitled to make a profit, but to mark things up by 3,000 and 4,000% is outrageous.
And Lisa, what difference has Holly made for you?
A huge difference. It's just like a load has just been taken off.
In this home, like so many across America, there's hope that Barack Obama's health reforms will make a difference. And soon.
And money was, I wasn't even thinking money, you know. It just makes you angry because you're thinking, this is America. Why is this happening in America? It's not like we're Africa. I don't know what it would take to fix it, but I know there's something that's better than this.
Come on up. Come here. I have to believe that it's gonna happen.
Shalonda Frederick, too, is putting her faith in the new president to change a health system which is crippling the economy and millions of Americans.
Whatever you want, Mommy gonna make it happen for me. If there's anybody that can get this, that has the power to change it, I have to believe in him. I don't have a choice.